Since I started making content on this app, I've noticed a lot of frustration from the pain management community, and I wanted to make a video about ethical pain management. Two primary complaints that I've heard on this app, but also locally, so I know it happens all over the US, are patients that go see a pain specialist. That pain specialist doesn't prescribe opioids under any circumstances for any problem for any patient. And then also patients feeling forced to have injections or procedures that they don't feel helpful to get opiate prescriptions. So there are some pain conditions that don't have an injection or procedure that are helpful for them, or the patient has tried injections or procedures and it didn't work for them, but the patient does get good relief from opiate medications and they use those medications responsibly. They may need to be on those medications long-term or for even the rest of their life. It improves their functionality and they use them responsibly, then that's an appropriate opioid candidate. Injections or procedures. It's important for us to be good stewards of injections and procedures. We should not be offering the same injection or procedure to every single patient, and we should never make a patient feel forced to have an injection or procedure. I went through a year-long fellowship so that I could responsibly do these procedures, but also responsibly prescribe opiates and alternative therapies for patients. But I try to think about each patient individually, treat them like my friend or family member. When I'm thinking about procedures, I'm thinking about good patient selection. Is this the right procedure for this patient? But then also being honest with them about the risk-benefit ratio, what kind of outcomes they should expect. So I'm not going to offer a procedure to a patient if I don't think it's helpful. And there are other pain specialists out here that practice the same way I do. All the pain specialists in my group, I worked at a previous academic center where I trained residents and fellows, and all the physicians there practice this way, where we responsibly thought about what could be helpful for this specific patient if we offered an injection procedure because we genuinely thought it could be helpful. So if you guys want to scroll through every single procedural video that I make, that's totally okay. But I put it on here just to provide educational content for people to understand when something might be helpful for them so that they can discuss it with their pain specialist. But I promise you that I would not put content on here that I would not offer to a family member or a friend, or that I don't offer currently in my clinic. So I hope that explains a little bit more about how I practice as a pain physician. And I am sorry that we've created a space where patients with chronic pain don't feel safe anymore. They can have these conversations with their pain specialists, because I do think it's important. So that's why I'm here, is to try to open up the lines of communication so that I can be a resource for you guys.